How to Prepare for Your Claim and Pension Exam, Lumbar Spine Edition. I've said in other videos, especially the initial video, which you should all go back and watch, on how claim and pension exams, how to prepare for them in general, is the first way to prepare for a claim and pension exam is to file the right claim in the first place. So if you're talking about a lower back problem and your lower back problem has led to weird tingling sensations in your legs or weakness in your legs, known as radiculopathy or maybe sciatica, it's important to claim those as well. Now, the VA is supposed to look for those when they do a back exam, which I'll get into more detail in a second, but they don't always find it. And sometimes the claim and pension examiner just rushes through that portion of the exam. So it's a good idea to actually claim that if you're experiencing sciatica or neuropathy in your legs or radiculopathy in your legs. But let's talk about the back exam. Now, for your lumbar thoracic spine, which is basically everything from your shoulder blades to your tailbone, what they're going to be looking at is basically range of motion. How far can you do your lateral twist, twisting side to side, bend forward and bend back? Sounds simple enough, right? Well, they're also going to look at how often do you have a back flare-up that limits these things. So this is where a pain diary or a pain journal can be really, really helpful. Did you have a couple days last week or a month ago where you couldn't bend over to tie your shoes at all? That's a good idea to bring that up and bring that diary to the claim and pension exam and maybe even upload it to the claims file itself. Do you also have tingling sensation, pain, or weakness in your legs? Document that and bring that to the attention of the examiner during the exam itself. Now, the other way the VA may rate a thoracolumbar or thoracic spine or lumbar spine condition would be on something called Inbal Dis Syndrome, IVDS. They measure that based on incapacitating episodes. Basically, how many times have you had to have just straight out bed rest in the last year as recommended by a doctor? This gets kind of tricky because most folks don't go to the doctor every time their back goes out. So again, your pain diary is what's critical. Keep notes, keep a diary. How many times over the past 12 months has your back just gone out where the only thing you could do is lay in bed on a heating pad and take Motrin and or Flexeril or whatever medications you're on in order to not just be writhing in pain. This goes to the document your symptoms rule, the DYS rule. Again, be honest, be truthful, don't exaggerate, don't undersell your symptoms either. Be prepared to talk about your flare-ups. Be prepared to talk about your good days and your bad days, what happens when you don't take your medication and when you do take your medication. And be prepared to talk about the feelings that you're getting in your legs, that you might be getting from the compressed nerves or the nerve pinches, what have you. And also be prepared to do range of motion testing. And finally, be prepared to take notes, because if they're not doing range of motion testing and they're not asking you a lot of questions, that might come in handy later. So take notes on that. Take notes on the overall exam, because knowing what happens during these exams may be important down the road if you need a new exam, because we all know some of these claim and pension examiners don't do the best job. So again, be watchful of that. So anyway, I hope that was helpful. Again, go back and watch the introductory video on how to prepare for your claim and pension exams, and hopefully this has been helpful and answered some of your questions. Until next time, take care.